I believe it was November of 2024. I was I was probably a week away from getting surgery on my left hip, which I had been to 3 different doctors. 2 of them had told me probably would need a hip replacement within a year or so. I'm 51 now, but I was 50 at the time. And it just didn't sit well with me. And then I decided to go to a hospital for special surgeries in New York City and speak with the person that deals with the type of hip situation I had going on. And he didn't think I needed a replacement, but he thought I needed a FAI surgery, I believe it's called. Basically, I have a overgrowth of bone, and he thought that bone was sort of impeding the movement in my hip socket and possibly doing some damage to my labrum, but they couldn't really tell for certain on any kind of imaging, MRI, CT. So they thought if I got this surgery, basically that I'd be good to go. But I started to get nervous because I had been hearing that people of over the age of 45, that surgery isn't necessarily the best way to go. None of the doctors I had seen had recommended doing any kind of physical therapy prior to the surgery. I was a pretty in shape person before, but I had experienced for probably about a year just this constant kind of pain/ache in my hip all the time, sleeping, resting, doing anything. So I kind of had really fallen off exercise. And then I saw Dr. Jessica's hip program being advertised on Instagram. And I had thought about it, well, maybe I should try this. And finally, I just got so nervous with the surgery because it's elective. I decided just to cancel it and try the program because I just thought everything I had read was sort of like, you really should kind of try physical therapy before any surgery just to see if you can maybe manipulate the hip a little bit more, maybe bring some more strength back into it, maybe heal the tissues around it and see if that helps before surgery. And then maybe the surgery would help recovery time. But I don't really want surgery. And so I just decided to kind of take that leap. And I'm glad that I did because it's really been very, very positive, very effective. So I decided to go with this program because there's several different, the internet is a black hole of information, but what kind of pinpointed this program was because the way that Dr. Jessica described what her issues were, her limitations, her pain sounded very similar to what I was experiencing, where the pain was, how the pain presented itself. And some of the testimonials on the website, some of the women were older in, late 40s, early 50s. And so that was kind of one of the reasons why I chose this program, because it sounded so similar to what I was experiencing. Even sitting, I would get pain in that left hip. And so I think that was probably the reason why. I just think that the thought process of first trying to pinpoint exactly how the pain would present itself, and then here are your steps that you can try to see if this helps. Just the way that the whole program was presented, I think, is the reason why I chose to do this particular program. And it was literally, I think when I emailed Dr. Jessica, I think it was either the day before or the day of the surgery I was supposed to have. So I really kind of went right up against it. But I'm very glad that I did. I've been with the program since November, and I was pretty consistent. Before the program, I was almost afraid to do any kind of exercise because I really wasn't 100% sure that it was, XYZ exercise that was causing the pain. So the way that the program was laid out was we're going to start really small, really calculated, and kind of build upon that. And if you're consistent with it, I really do think that it really helps with people in my predicament. Just the whole mobility, then the strengthening, and then the whole pelvic floor, I guess, educational part of it was also very interesting. It's like kind of mind-boggling how much in that hip area and the pelvic floor area, it's just sort of like the center of the body, and there's just so much going on there. And the program really helps kind of peel away each layer to really figure out, well, then why is your pain coming? Is it this? Is it this? And so for me, it was really this kind of aha moment I had when I did one of the exercises that focused on this tiny little muscle in your deep glutes that in my situation was just would not relax. And so doing these very specific exercises for that muscle group really literally kind of opened up my whole hip girdle, I guess. And then the component of the internal pelvic floor exploration, if you will, was eye-opening because of how connected those two areas are. And so for my experience, doing that stuff almost on a daily basis has really, really helped kind of just calm the hip down, calm all those muscles down. And then after you kind of get everything calmed down and literally stretched out, then that slow building where I am now, building back up some muscle endurance, muscle strength in those areas has really helped. I don't have the same, like I can sit my daughter goes to college in New York City. It's about a 5-hour drive for us, where in August when we dropped her off, we had to stop twice so I could get out and stretch the hip. When we got to New York City, I remember getting out of the car and literally limping to her dorm. And then I just dropped her back off a couple of weeks ago for spring break. I drove there. We didn't stop because she needed to get back. Drove there, was fine. And got up the next day, drove home, didn't stop, was fine, no pain, was walking normally. So, I mean, it's amazing to me how much these very specific, not very time consuming exercises can really help. And in the mindset part of it all was just like, you just have to kind of trust your body that after a year of experiencing pain, the tissue, if there was any kind of tissue damage, that has probably healed itself. And it's literally just kind of your mind being like, oh my gosh, we can't do this. And so that the mindset component with the literal exercise component, with the pelvic floor component, all of that together in a consistent way is really life-changing. So the way that the program is laid out, it's every week. I liked how it's so calculated that, okay, here's what we're working on for this week. And under those are all these very specific things that address what could be happening for you. And you can go through all of them and then sort of kind of cherry pick which ones resonate for you. So for me, it was the accessory exercises and mobility movements, where there was just other different things that you could choose that were making everything really kind of come into a little bit more focus for me. So one of the movements was just like laying on my side with a pillow in between my legs and kind of drawing that femur back just to kind of access that deep muscle in the glute again. So all that accessory stuff, and then the whole mindset component of it, and then teaching you how your brain kind of works to sort of, and your body sort of holds on to that pain and how to kind of mentally release it. And then the whole pelvic floor component was eye-opening to me. Why they don't, if you have children, why they don't kind of give you any kind of information like that once you have children is beyond me. So that was really, really eye-opening to me, the whole pelvic floor component. But I guess I just liked how the program was set up, in that everything is so specific to if you have this here, you can go here. If you have this kind of issue, you could go here. There's just so many different options that you can choose from to really kind of hone in on your specific issue. It's not like other programs I feel are kind of more generalized. There's just so much information, and the way that you can kind of reach out to any of the therapists anytime to ask questions, and the meetings that are available to you almost every single day at different times that you can reach out. So it felt like you were extremely supported in every aspect. My advice is to really just to try this program, because I think, as I said, the way it's laid out, no matter what your issue is, there probably is something in there that could help facilitate, even if you facilitate you feeling better. Even if you still have to get the surgery, I think having all this knowledge and truly understanding how everything kind of works together and sort of getting your body ready for surgery, I think is probably much more beneficial than not having done any kind of physical therapy, strengthening, and just doing a surgery and not having that backbone, I guess, before the surgery would probably be a much longer recovery. But I think that if you just tried this and if you were consistent with it, I really do think that most people could probably benefit from less pain, less immobility, more just feeling much more confident about yourself and the decisions that you make about a surgery. I mean, I was skeptical. I looked at the Instagram for probably 3 months before I decided to do it. And the only reason I'm skeptical was because, it just sort of like nobody else was saying anything. Everybody was just like, oh, you need a hip replacement, or, oh, you need this surgery, or, oh, this is going to make you feel better. Nobody said, let's try this first. Let's start slow and low and kind of build up. If you still need the surgery, fine. But nobody was kind of framing it in that way. And I get it. I think that sometimes when you see stuff on Instagram, you're like, oh, how real can this be? But I'm here to say it is 100% real. And it really, really works if you do it consistently, if you really put in the work. It's not easy. And there were days, and, I started in November, and it wasn't probably until after Christmas, maybe early January, where I started to kind of like, just kind of woke up one day, literally just didn't have any pain. Like it was, I think I wrote it down in my diary, but it was an actual day, but it took, every day doing a little bit of something. I think you really should just try it. It's only for 3 months. If you still have the pain, still aren't feeling comfortable, then get your surgery or do something else. But I think if you try, you'd be pleasantly surprised, like I am. The only thing I would add is if you are over the age of 45, I think your body starts to shift and change, even if, like myself, have been lifting since I was the age of 16. And then all of a sudden around 45, 46, I started to notice differences in my strength and maybe not feeling the best afterwards. And so you have to kind of be gentle with yourself, I think, as you go through this menopause change. And this program kind of touches on that a little bit. But it also, I think, is the mindset of it's okay to take things slowly and very deliberately. You don't have to kind of run into the gym and lift 200 pounds in 6 weeks. That kind of gentle guidance, I think, is really, it's nice to hear, and it's nice to kind of have that kind of reinforcement, especially if you're over the age of 45, in my opinion.